Okay, welcome. This is the Unit 1A of the ESOT 344, the Fall Neuroanatomy course. And in this unit, we're going to be talking about an introduction to neuroanatomy. First question is, what is neuroanatomy? Now, all of you know what anatomy is. You've just completed your gross anatomy over the summer, and hopefully it went well for everyone. So now, more specifically, we're going to be spending this semester talking about neuroanatomy. And quite a short definition is neuroanatomy is the study of the nervous system's anatomy. We're going to be looking at the brain, and we're going to be looking at different components of the central nervous system and identifying structure. That's what anatomy is. We're going to be identifying different structures. More specifically, neuroanatomy emphasizes the central nervous system and studies its structure and function. So we're going to be looking at the different structures, we're going to be naming those structures, and we're going to try to assign a function to those different structures. As we start trying to develop over the semester, and the goal for this semester is to develop a three-dimensional appreciation of the brain and where different structures lie in respect to other structures, it's important that we understand the different planes of the body. So we have the three dimensions and the three planes of the body. The first will be coronal plane or the frontal plane, and this is simply dividing the front to back. Next, we have the sagittal plane, and this is where we look at left to right. And then finally, we have the transverse or horizontal plane, and this is where we're looking from top to bottom. So these will be horizontal sections that we will be looking at. Next here we have the planes of the body, and we can see that we have the medial or the sagittal plane dividing left to right. We have the transverse plane dividing the upper from bottom, top to bottom, and then we have the coronal or frontal plane, which will be front to back. So planes of the body, the coronal section front to back. Here we can see we have a cross section of the slice of the brain, and this is a coronal section where you can see in the upper left-hand side where we have a cross section from front to back. So this, we're looking at the front of the brain. We have the left side of the brain, and then this is the right side of the brain. And here we have basically the midline through the brain. So this is a coronal section, looking at it from front to back. The next is a mid-sagittal section, and this is where we look at the brain from going from the lateral aspects towards the center. Here we're going to have a mid-sagittal section, and this is a section that basically just divides the brain down the midline. So we can see we have the brain and we have all of the midline structures. So a mid-sagittal section denotes a sagittal section that divides the brain into two equal parts. So this is where the brain is divided equally into the left and right brain. And what we actually see in this diagram is a picture of the right hemisphere, or the right portion of the brain. And then finally, planes of the body, we also have the transverse or horizontal sections. Now this is where we're going to be looking at sections from top to bottom. Here we have a section looking at it from above, and here we have the left part of the brain, and here's the right part of the brain. We're looking from above, and we basically can look at this section now to have a transverse or horizontal section of the brain. So we're going to be looking at these sections throughout the semester, so it's important to understand what is the overall dimension that these sections were actually taken in, or that you're viewing the brain. Now the next aspect that is important for us as we basically start developing this three-dimensional analysis is the overall orientation. Where are structures located in reference to others? So again, this allows us to identify the location of a structure in reference to its position. And here we have different terms. These are terms you should all be familiar with from your gross anatomy, but first is dorsal or posterior. This is towards the back of the body. Next is ventral or anterior. This will be towards the front of the body. Next is superior, which means from upper or from above. Next is inferior, meaning from lower or from below. Cranial means the head end. Rostral will mean the nose end. And then caudal will mean the tail end. So we have dorsal or posterior, ventral or anterior. Then we have other terms such as superior, inferior, cranial, rostral, and caudal. And understanding the definition of these different terms will allow us to identify the location of some structures in reference to others. So let's go through some practice for orientation. Here we have a lateral aspect of the brain. So here we're looking at the left side of the brain. So this is the anterior aspect of the brain. This is the posterior aspect of the brain. Above we have the superior aspect, and here we have the inferior aspect of the brain. We can see some structures. You're all aware that this here is the cerebellum. Well, that lies on the posterior inferior portion with respect to the cerebral hemispheres. So again, now we know that the cerebellum is in the posterior inferior quadrant. So again, it allows us to identify the cerebellum with respect to the cerebral hemispheres. Now, the next component to understanding neuroanatomy is the information that is gained from stained versus unstained sections. Now, sometimes we're going to look at unstained sections. Other times we're going to be looking at stained sections. And the value of this is that by understanding what we're looking at and what is the advantage of stained versus unstained section, it's helpful for identifying the neural composition of a structure. As you all know, neurons comprise the basic signaling unit of the central nervous system. And neurons quite grossly are basically made between cell bodies and their fibers or their axons. The cell bodies represent the metabolic centers of the neurons versus the axon, which is the conducting element. This is the area where the action potential is basically transmitted to a different portion of the central nervous system. So in unstained sections, these are sections that are basically, that we're going to look at where the brain has been removed from the body and has basically been either viewed or cut, or a section has been taken and it's unstained, it's unprocessed. So it's just a picture of the brain, what it would look like if it basically just came out of a cadaver and we cut that brain. In an unstained section, again, this is an unprocessed section, areas that are composed largely of cell bodies appear dark, whereas areas composed predominantly of fibers, by fibers we mean the axons, appear lighter. You're all aware that the axons are covered with a fatty sheet of myelin. If you think of fat, think about a white color, a much clearer component. So where we have a large and unstained fibers, where we have a large or unstained sections, where we have a large accumulation of fibers or axons, what we start seeing is a lighter color because of the large density of myelin in that cross-section. Whereas myelin does not surround the cell bodies, so those appear darker because they lack myelin. Again, that's unstained section. The next is a stained section. Sometimes individuals or scientists will stain a section. And we're going to be looking at some stained sections. The advantage here is that in a stained section, you treat a section with certain chemical compounds. And these stained sections will be that the cell bodies which lack the myelin do not take up the chemical, the stain. Whereas the axons, which are covered with myelin, readily absorb the stain. So as such, the cell bodies that don't absorb the stain will be light, versus the axons covered with the myelin that does accept or take up the staining material will appear dark. So now let's compare stained versus unstained section. In the first example here on the left-hand side, we have an unstained section. So this is our, what we call our mid-sagittal cross-section. Again, this was a section right down the middle, dividing left to right, and what we see here is from your page 31 of your textbook, and we can see there's a cross-section here, and the structure I'd like for you to focus on is this structure here, and then you could see that this structure is predominantly lighter compared to the other section. This section here is known as the corpus callosum. So knowing that this is an unstained section and it's predominantly white, do you think it's composed of cell bodies or axons or fibers? Well, if you answered cell fibers, you'd be correct. The corpus callosum is made up predominantly of axons, and this is where fibers or axons are connecting different portions between the left and the right brain. Here the corpus callosum has been cut in this cross-section, and we could see that there's a large density of fibers. Contrast this to the picture on the right. Here we have a stained section. So here we basically have stained a cross-section, a similar cross-section, not the identical one, but sort of a similar one. And now the corpus callosum, what do you notice? Here the corpus callosum appears to be dark. Now this section here has been treated with a chemical stain. The myelin absorbs the stain, and as a result, areas rich in myelin now are very, very dark. Contrast that to those areas that don't accept the stain, don't contain myelin, and are comprised of a large population of cell bodies and not fibers. So we can look at the corpus callosum in green and see how it's almost a negative image of the unstained section because, again, areas. So if I point to this structure right here and I say, tell me what is the composition of that? Is it predominantly cell bodies or axons? Since we're looking at a stained section, we can see that this area here is very, very dark. Remember, in a stained section, the myelin accepts the stain, so this would be composed primarily of fibers or axons, and that is what I just pointed out to you is the optic nerve. If we look at it, the optic nerve in the left side section, this here is the optic nerve, and you can see in an unstained section that is fairly lightly colored. So that's to contrast the difference between stained versus unstained sections. So now let's look at a few examples of what we've already looked at. Now we have, so again, firstly, what is the plane of this cross-section? If you answered this is a coronal section and it's an unstained section, this is what it would look like. So this is unstained, so here we can see in this coronal section, again, front to back, we can see that there are certain areas in their cerebral hemispheres that stain dark, closer to the surface, and those areas are comprised primarily of cell bodies. We can now look at the areas that are lighter. That's where we have a large accumulation of fibers or axons. This structure right here that I just pointed to, what is the overall makeup of that structure? Yes, we have a large area of axons, and this is a view of the corpus callosum that we had seen previously. We said the corpus callosum was made up of a large accumulation of fibers, and you can see that those fibers run between the left hemisphere and the right hemisphere, connecting different parts of the central nervous system. So this is a coronal section, an unstained section. If we continue with our stained versus unstained, now again, what is the orientation of this cross-section here? Okay, if you've answered horizontal or transverse section, you were correct. So again, is this, now you have to basically decide, is this stained or unstained section? If you answered unstained, you were correct. And you can see how we have different shades of gray. Those areas that appear very, very light in coloration are comprised of axons. versus the darker areas are composed of a large accumulation of cell bodies. So if I were to ask you what is the composition of this structure right here, is it fibers or axons? I'm sorry, cell bodies or axons? If you answered axons, you'd be correct. And that's also a portion of the corpus callosum that connects different parts of the left and the right hemisphere. And then finally, with the stained versus unstained section, now we have a section of the spinal cord. And so what is the overall orientation of this section? If you basically said horizontal, you'd be correct. Now, is this a stained or an unstained section? Well, this is a stained section of the cross section. Now remember, in a stained section, the myelin absorbs the stain to give it a dark appearance, whereas the cell bodies do not absorb the stain and have a light appearance. So if I basically said what was the overall composition of this portion of the spinal cord, and you said that since this was a stained section, since that's a lightly stained, it's composed primarily of cell bodies. Contrast this to this area here of the spinal cord, and here we have a darkly stained section, and that is primarily composed of axons. So we can see in the spinal cord there's a nice segregation between the fibers, the axons, and the cell bodies. And we're going to be learning the different components a little later on. So this completes Unit 1A, our introduction.